Going to give everyone a moment to join here. All right, we're just going to start by introducing ourselves and then we will head into the presentation here, which will be a mix of information that we would like to share, and then we'll also do a basic Q&A as well. If you have any questions as the attendees, there is a Q&A box that you can type them in. So we highly recommend that you do that, and then we can answer them throughout the presentation here. So just to get started, my name is Julie. I'm the Senior Associate Director. I am based out of our Worcester campus. I oversee our accelerated program here, and I am joined by a couple of colleagues. So I'll hand it over to Ryan.
Hi everyone, I'm Ryan. I am an associate director on our Boston campus, and I work with pretty much any pharmacy students that want to attend, specifically Boston. I'll pass it over to Professor Toll.
Hi, great. I'm Dr. Jennifer Toll. I'm one of the pharmacy practice faculty members, also an alumni at the Manchester campus. I teach in the accelerated pharmacy program, and I have a clinical rotation site in internal medicine at a hospital in Concord, New Hampshire. I'll turn it over to Bridget. I'm stupid.
Hi, everybody. My name's Bridget. I'm a second year student on the Worcester campus, and I'm from just about 30 minutes outside of Worcester.
So just to get started, we like to show some facts about pharmacy. I think there's a lot of information out there about kind of what does the market look like, what is the return on investment for going to graduate school and spending money on this degree. So we just like to highlight a couple different things about our school in particular. As there you see the median annual wage of a pharmacist by the U.S. statistics. We are rated number 3 for return on investment by the Georgetown University Center on Education and the Workforce. So again, in spending that money on your graduate education, you will get a return on that investment once you do graduate. And we are one of the top pharmacy schools or have pharmaceutical sciences programs in the country. But besides some fast facts there, usually what we like to do is have our faculty member here kind of chime in on what are we seeing currently in the workplace in terms of, being a pharmacist now. We just had graduations. We just had a bunch of our students graduate and heading off into workforce, and maybe share some of the things that they're going to be doing in the future.
So our students do a wide range of things with a PharmD degree. There's a lot of different options of career paths. We try to help students while they're in the program explore a lot of those different options so they can kind of see what the best fit is for them. All of our students that are graduating are finding jobs. There's a good job market out there right now. A lot in community, hospital, ambulatory care is a large space that is growing quite a bit, and we expect that to continue into the future. And our students also have an opportunity to explore postgraduate opportunities. So after you graduate, there are some other additional educational opportunities that can help you get into some different spaces. So residency and fellowship. And this year, particularly, we had quite a few students match in both our residency application process and the fellowship application process. So it's really exciting to see where our students are going and kind of watch where they're headed in their careers. So that's a little bit about after graduation.
We have our Boston campus, which is where Ryan is based, and that is kind of our main campus here that people are most familiar with. It's our undergrad campus. That's where directly at our high school attend. It is pretty old. It was founded in 1823. So a couple of years ago, we did celebrate our bicentennial there. We have about 4,500 students. We do have a mix of undergrad and graduate students at that campus. So it's not just undergrads. And it is located in the heart of Longwood Medical Area, along many of the major hospitals that people affiliate with Boston. We then have Worcester, which is where I am currently based, which is about 45 minutes west of Boston. It is the second largest city in New England after Boston. There are many healthcare opportunities here as well. We have 2 major hospital systems, as well as many others within the greater Worcester-Boston area. We were founded in the year 2000 and have about 1,600 students. Unlike our Boston counterpart, the students who come into our program here at Worcester and in Manchester must have some type of college coursework for our programs. But we do, again, have a mix of students, some, on the younger side, maybe have done community college, and then other students that have finished out their bachelor's degree are now pursuing a graduate degree. And then finally, we have our Manchester, New Hampshire campus. Manchester is about an hour north of Boston. It is the largest city in New Hampshire. It definitely has a mix of having like the amenities of a city, but more of like a suburban feel, which is great for those who maybe are not looking for the hustle and bustle of the big city. It was founded in 2000. It's a little bit of a smaller campus, which is really great for our students. Many of them say they get to know the students in their cohort. They get to know the staff there. So many students really, really enjoy that. And that's where Dr. Tola is based. But I'm going to ask Bridget, she's based at our Worcester campus, why she was, kind of gravitated towards that option.
Yeah, so for me, I knew I wanted to do the accelerated program, so that personally cut out the Boston option for me. And then Worcester is just a really cool city. They have so much life there. There's such good food. And it's also a really drivable city, which for me, I really appreciated. And so that was my main reason for Worcester, as well as it being closer to my house than Manchester. But I will say that our Manchester cohort, there are classmates as well. So really, like if you choose between the two, we're all together in the same classes. So it's not like we're all doing the same thing together. So it really is just based on where you want to be location wise.
Awesome. And then just a little bit about our direct entry PharmD program on our Boston campus. So while we do have the direct entry 6-year program for students that are ready for that professional phase entry, that is a 4-year professional phase out here in Boston. We run a traditional fall and spring semester with summers off. So that is mainly why there's the difference in time to graduation from the accelerated campuses. We do have that pre-professional entry available, so if students are looking to come straight out of high school or transfer in without all their prerequisites done, you can finish those on the Boston campus. And then, you can either stay in Boston or apply out to Worcester or Manchester once you're ready for the professional phase. So that's, again, certainly an option for students if they prefer. And then a couple other unique things are we do have an honors program on the Boston campus, specifically a PharmD honors program. Really great opportunity for some research. And then again, we do have the freshman entry available where you can do the 2 pre-professional years with us, and then again decide on kind of what you want to do on the professional side once you get to that point of your education.
Then we have the accelerated program. So the accelerated program is a 34-month program. It is only offered in Worcester or Manchester. It's not offered in Boston, just like the 4-year program is only offered in Boston. From an accelerated program perspective, doing the same coursework as a student in Boston, we all follow the same curriculum. And the real difference is that we have a summer semester added in. So our summer semester actually starts on Monday and then will run till the end of July. Where the Boston students are done for the summer and they'll just come back in September. So that's really the main difference between the 2 programs in terms of like just the way the program is structured. So keep thinking about kind of which one. Sometimes we get some wacky questions about, so we're doing other things. And when people hear accelerated or they think about like mini semesters where some school offer like these mini like 8-week semesters, we follow a normal calendar. We follow the same calendar as our Boston counterparts. We only offer professional entry, so you must do all your prereqs before you come in the door. So we have a list of prereqs, some for students who have a bachelor's degree, and then there's a longer list for students who do not. But you must have all of those completed before you start our program, unlike in Boston where you can come in for pre-professional entry. The other thing we would like to highlight, it's not on the slide, but it is something that we do offer. We offer a hybrid online program that is new for fall of 2026. It is pretty much the same as the Worcester and Manchester program. It's just the way the content is delivered is different. There are some nuances there. If that is something that you are potentially interested in for the future, you can certainly reach out to me. My contact information will be at the end. And I'm happy to provide more information on that program there and kind of what that looks like. But it is professional entry also only for that program. The final piece that we will highlight is that all of these options, so there's 4 if you're keeping track, have their own FarmCats application. We do ask that you only apply to one. FarmCats will be more than happy to take your money for all 4, and we will receive all of the applications, but then we will reach out and ask you which one you'd actually like to be considered for. And there's no way for us to refund you that fee since it does go to FarmCast. So just make sure that you fill out for one. If you're not sure which program you're interested in or which one would be the best fit for you, you can certainly reach out to Ryan or myself, and we'd be happy to kind of direct you based on, you know, your prior experience and things like that. But again, once you pay the money, it's gone. So just keep that in mind. So at this point, we're going to ask our 2 panelists, our faculty member and our student, some questions about kind of their experiences here, and then we'll get into more of the nitty gritty of just about applying. So I know that Bridget has done her IPPY rotations, and we'll soon go out on APPY, but if you want to share a little bit maybe about your IPPY experience and then which APPY you are most excited for or most looking forward to.
Yeah, definitely. So my first IPPY was my community-based IPPY, and that was at a Shaw's Pharmacy, which if you're not local, that's like one of our grocery chains around here. And I really loved it. It's such a great opportunity to learn a lot about giving vaccines, and I did a lot of calling patients and talking them through if they were like behind on refills, trying to figure out if they were taking it, and doing a lot of counseling with that, which was really cool. And then for my second IPPY, that was called my institutional, and it was at Leominster Hospital, which is a hospital that's around like 45 minutes outside of Worcester, and it's close to my house, so I was very excited about that. And what was really cool is they have an offshoot infusion center in oncology in Fitchburg, and I'm in the oncology concentration. So I had mentioned that to my preceptor, and she was able to get me to go over there for 2 of the 4 weeks. So I got to be in the oncology pharmacy, and they do really just oncology meds. So I got to learn a lot about all of those different meds. I got to see them doing the sterile compounding of the chemo, and a lot of really cool experiences. And that's something that I think with MCP is that they work to get preceptors that really care about like you personally, what your interests are. Because originally I wasn't supposed to go to the oncology center, but after I mentioned it, she got me in there, which I think is really cool. And then for my APPYs, I'm doing the longitudinal APPY at UMass Memorial Hospital. So all of my APPYs will be there. And I think the one that I'm the most excited about is my elective, which is ICU. Because I've worked in a hospital for the 2 years before I came to pharmacy school, and I worked on a med tele floor. So we had like not super acute patients. So I'm excited to get to learn more about those acute patients and see. Obviously, it's like very complicated medication regimens. So getting to really dig into that and learn more in that aspect is what I'm really excited for.
And then Dr. Lowell, can you tell us what maybe sets MCPHS apart as a pharmacy school? I know that you have a unique perspective since you were here as a student and now are back as a faculty member.
Yeah, I mean, I definitely think the longevity of our program, the Accelerate program has not been been around as long as the direct entry Boston program, but obviously you all are one big network, so we get to learn from each other. But even in the Worcester Manchester programs, many of my colleagues that are, you know, now that I work with, they were my faculty members, you know, so the faculty have been around for a long time. They're very good at what they do. They're very caring with students and very excited to be teaching. The thing about MCP is we are a teaching for university. We don't have TAs. Everything that's taught in the classroom is taught by a faculty member. So you're going to hear it from experts, people that work in the field. If you're a pharmacy practice faculty member, you have a rotation site, you're still going to the hospital or the community pharmacy or the M-Care Center, and you're still working with patients and advanced rotation students. So you're getting your education from people that are actually doing the work. And I think that's one of the most valuable things, to be able to ask those real world questions and bring real world into the classroom.
So one of the things here that we focus on our students have access to many clubs and organizations that promote the pharmacy profession and can kind of showcase you different areas of pharmacy. It's also, you get to interact with other students. So for, Boston, you're on campus, a mix of the different years. And here in Worcester, Manchester, you're on campus really just for the first 2 years of the program. So that's when you kind of get to explore different areas. And I know Bridget has been actively involved in some of those organizations. So I just want her to elaborate a little bit more on what she did.
Yeah, of course. So I was on the e-board for three organizations this past year. So the first one I was on was American Pharmacists Association, which is one of like the biggest pharmacist associations in the US. And so in our chapter, I was the Operation Diabetes chair. And so I got to plan two different events that were diabetes related and just bring awareness and education about the disease to the student body. And so that was a lot of fun and really cool. And then I was in the Industry Pharmacists Organization as the historian. And so what we do in that club is we help students understand the role of the pharmacist in industry roles, so like pharmaceutical companies. And we were able to invite several fellows to campus to speak with us about what they do in their roles. And it's really great because MCPHS has a program with a bunch of pharmaceutical companies. And so there are a lot of fellows that have that link with MCP. And so we're able to use them as a resource, which is really great. And then the last club that I was on the e-board for was ASCP, which is the American Society of Consultant Pharmacists. And our main goal in that club is to advocate for basically like geriatric patients. And I worked with geriatric patients at the hospital before I came here. And so that was a cause that was really close to my heart because a lot of times geriatric patients can kind of fall through the cracks. And a lot of times they have like polypharmacy. So they're on many, many meds and they don't really know what all the meds are for or why they take them and things like that. So we work to just try to help bring that understanding to our patients. So I really loved my time in my clubs. And now we've just passed off the torch to our first year students to take over in the e-board. So I'm really excited to see what they do for this next year.
And then we do have a host of electives that take place in our program, or I should say we have elective choices that students can choose from, things from like dual degrees to certificate programs to a research concentrationship. So I'm going to turn over to our faculty member, Dr. Tal, to talk about maybe what some of the students have done, because I know that's a question that comes up a lot is kind of the opportunities that are available here. And many of these opportunities, everyone should be aware if you're thinking about Boston, also exist in Boston as well.
Yeah, so we've had students do a number of different, take advantage of a number of different options. The dual degree option is really nice because you can start a master's program on top of your PharmD and then finish it even after you graduate at a discounted rate. So we've had students that have done the Masters of Business Health Administration. There are concentrations, which Bridget, you had mentioned. I think you're doing the oncology concentration. So that incorporates a lot of research, bench research, along with presenting posters and being able to dive a little bit deeper into some of those research skills. A lot of students really like, we have a geriatrics concentration, a pediatrics concentration, certificates in med safety. We have certificates in precision medicine, which is kind of like a genomics, looking at pharmacogenomics and matching up medications with your genetics, essentially. And so finding treatments that are going to work the best for you based on your actual DNA. So there's a lot of really exciting choices to be able to enhance your degree. You can, explore a different area or, add on towards that career trajectory that you're hoping to get started.
And then one other thing that we get asked a lot is like what makes a strong applicant? And obviously this varies, but what's something that we're looking for, in terms of, what would be something that would be an ideal applicant from maybe a application side or even from an interview side in terms of like what we're looking for since we do virtual interviews. And I'll hand it to Dr. Tao for that.
Yeah. When we're looking at applicants, the first step is we oftentimes will be reviewing application. So, what we're looking for in the application isn't perfection. We're looking for a student that is learning and growing. We're looking for someone that's taken a lot of heavy sciences, especially together, because throughout our curriculum, that is going to be asked of you. And so, can you handle that workload? Can you balance kind of some of those things? You don't have to have pharmacy experience. That's a myth. You don't need pharmacy experience. I think just a knowledge of what a pharmacist does and that this is the career path you're looking to go into is helpful. In the interview, I just like to have a conversation. I always start out telling them a little bit about my background, ask them to tell me a little bit about them, and I want to make sure it's a good match for them. Like our program is a good match for them, and that I can give them information about our program, answer the questions they have. I like to see someone that's prepared for the interview, like comes in, like has some questions, that's interested in talking to me about the program. Those are always excellent signs that this might be the right decision.
All right. And now we're going to get into kind of more information about how do you apply for our program.
Awesome, thank you. So I'll briefly mention the pre-professional entry first. That one's super simple. If you want to apply for that, you just go to our website, click apply, and it's just straight through the website. But for students seeking professional entry, which again that encompasses all campuses, you'll want to get familiar with FarmCast. It's farmcast.org. And if you go there and fill out the FarmCast application, you'll be able to select again, as Julie mentioned, the specific campus that you want to apply to from MCP. Just a reminder, pick your top choice for a campus, as we can only consider you for one. But in your FarmCast, you will need to submit a number of different materials to complete that application. First, it starts with your transcripts. So we do need transcripts from all colleges you've attended. If you have attended multiple, we need them all. If you have any international college experience, we do also need that. But we do need that translated and evaluated by WES, which that is just if you go to wes.org, you'll find that evaluation service. And we do need that so we can have the US equivalent of the coursework and see again that, if you're, needing prerequisites from that they line up. We do require one letter of recommendation at a minimum. You can definitely submit more letters of recommendation if you prefer. They could be academic letters of recommendation. They can be professional letters of recommendation, or a combination of. But again, we just require a minimum of one. You will need to add a personal statement. It's about 500 to 1,000 words. You'll see the prompt right on FarmCast. It's primarily just, kind of why you want to get into pharmacy. But that's something you'll need to add to your application. For any students that are not English or non-native English speakers, you may need an English language proficiency, proficiency exam. We accept a few different ones, TOEFLs, Duolingo. There's the IELTS. There's quite a few. They're listed on our website with the corresponding score needed. So if that applies to you, you can look it up on our website or just ask one of your admissions counselors and we can let you know what you would need. And finally, we do not require the PCAT. So that is not something that you would need to consider doing in order to apply for our PharmD program. Now, a little bit more about the application other than just, what to submit. Well, first, when to submit. So there is still time to submit for this upcoming fall. If you're thinking, you might want to start this upcoming fall, this September. The deadline to apply is June 1st. So you have a couple weeks. My recommendation, if you're thinking, maybe you might want to start this fall, is apply now. We're happy to review your materials, and get you through that process as quickly as possible so you can see if this fall would be a good fit. For anyone that's looking more in the future, like fall 2027, applications do open on July 9th. So that is when the application will open up for the following cycle, July 9th for fall of 2027. And then you'll have plenty of time to apply, but I do recommend applying early. I think we'll talk about it in a future slide, but it's always helpful at one, making sure there's space available, and two, making sure that there's as much merit scholarship funding as possible as well. I know we've already talked a little bit about, competitive applications, but we do look at a number of things, so I just want to kind of highlight a few of those. We do not only look at GPA, but that is something we do consider. We look at your cumulative GPA, your science GPA, your prerequisite GPA. So trying to do as well as you possibly can in all these areas is always helpful when we review your application. Beyond the grades, we're also looking at, why you're interested in pharmacy. I think that initially shines through maybe in a lot of personal statements, maybe in work experiences. So if you have healthcare or pharmacy specifically experience, then I think that shows really well to the committee that you have some experience that has shown you that you are very interested in this area in this field as a career. So I think those are also really helpful things to have on an application. And then, once we review your application materials, we'll be able to determine if you're interview eligible or not. I believe Julie already mentioned we do interviews virtually. So, usually more convenient for everyone involved, including our students coming from all over the globe. They usually last like about an hour, but we'll invite you to those interviews, if eligible, once we review your PharmCast materials. We do get a ton of questions about prerequisites. So the prerequisites can vary, by program. Definitely check them out on our website for, more specifics as to what the exact prerequisites are, depending on, which campus you want and everything. But as kind of a blanket rule, we require a grade of C or higher for any of these prerequisites. So a C or better is good. A C minus or less would not qualify for the prerequisites. And you would likely have to retake that course if you got below a C. We do have a 10-year expiration for math and science prerequisites. If you have any coursework that's older than 10 years old, that's reviewed on a case-by-case basis. So something you would usually find out more, after you've applied and gone through that part of the process. There's not really much we can say before you've applied on that, because again, it's reviewed really case by case. And then just one more highlight is you can have courses in progress as you apply. So especially students that are thinking about applying for this fall, if you are doing summer coursework to wrap up your prerequisites, no problem. We need the prerequisites complete by August, but you should still apply now because the deadline to apply is June 1st. We can still consider you if you're wrapping up a couple prerequisites. That's no issue. All right, a little bit more about, once you've applied, figuring out the financial piece. So all applicants are automatically considered for merit-based scholarships. You don't have to do anything special to apply for that. We consider every single student just when they submit their application. Obviously, being merit-based, I think that's another reason that if you're still doing coursework, the better that you can do in the coursework, it always helps your chances in that regard. And also, the earlier you apply for those students that are thinking, especially like fall 2027, when should you submit your application? Well, sooner is always better because there is typically more merit-based scholarship funding available earlier in the cycle. So apply early, and I think that always helps your case both for space and funding. Beyond merit-based scholarships, you'll also have, just like your FAFSA. If you're a domestic student that is eligible to submit a FAFSA, highly recommend doing so. That can be another piece of the puzzle at you, trying to finance the education, depending on if you're coming just with prerequisites or with a whole degree. It can vary depending on what types of awards you might qualify for, also based on other factors. But I think always helpful to apply for it. Worst case, if you don't want to use something that you're awarded in FAFSA, you can always decline awarding. But I think always helpful to apply. And with all this being said, we definitely understand that the financial piece is definitely a big consideration for students and can be confusing. We're here to help with that. We do what we call affordability appointments. So, after you're admitted, after you get your scholarship evaluation, your FAFSA, your financial aid evaluation, we're more than happy to break down all this with you so that you understand better exactly what to expect on your bill and to have as an overall cost and your different ways of funding your education before you commit to coming. We want to make sure that that piece is very clear for you and also lines up with being a good fit here as well.
So here's our contact information for Ryan and myself, as well as a link to our visit page in case you want to check out other opportunities that we have. Now is a good chance if you have questions to type them in the Q&A box and we'll be happy to answer them in real time. There was one question that came in while Ryan was talking about requirements. So somebody asked if they had a foreign degree outside the US. You would apply through FarmCast just like everybody else, as Ryan mentioned. You do need a transcript evaluation. We do prefer WES, but if you have an EC, that will also be looked at. You can also send it directly to us. You don't necessarily have to send it to FarmCast. So just keep that in mind, but you still need to apply through FarmCast. And you would need to complete the full pharmacy program. So we can use like your previous courses potentially to fulfill prereqs. But if you were to apply to the 4-year program, you would expect to do 4 years. If you applied to the accelerated program, you would expect to do 3 years. We don't waive courses in the actual professional phase of the program based on prior coursework. So just keep that in mind that you are still looking at the full kind of gamut of courses there. But again, if you have any questions, definitely feel free to type them in. We're going to give you a minute or two. While we're doing that, I'm just going to ask Bridget here one piece of advice she would give to future pharmacy students or students who are going through the potential application process right now.
Yeah, I think it's so easy to feel like imposter syndrome while you're applying and like when you're first getting to campus. And I know I feel like everybody does feel that, and you can wonder if you're cut out for the program and things like that. But I always like to remind people that if you've made it this far, you can keep going because obviously the prereqs for the programs are very challenging. And if you've done that, I can promise you, if you put your work in, you can do this program as well. So I would say don't be nervous. Like you're obviously going to be, but but you can do it. And people have done it for years and decades before you, and they'll do it after you, and we can do this.
It looks like there's no questions that came through, which is totally fine. I know we provided a lot of information today, but again, our contact information is there. So if you do have any questions for us, Ryan or myself, definitely feel free to reach out and we'd be happy to answer them either for this cycle or next cycle. So hopefully we will see your application come through soon, and we wish everyone a good night.